Prescription opioids are medications that are chemically similar to endorphins, which are opioids our body makes naturally to relieve pain. Prescription opioids usually come in pill form and are given to treat severe pain, such as pain from dental surgery, serious sports injuries, or cancer. Some examples of commonly prescribed opioids are Oxycodone, Coedine, Fentanyl, Morphine, and Hydrocodone. Opioids attach to specific proteins called opioid receptors on nerve cells in the brain, spinal cord, gut, and other organs. When these drugs attach to their receptors, they block pain messages sent from the body through the spinal cord to the brain. This causes a strong feeling of relaxation and euphoria. Opioid receptors are located in the brain's reward center, where they cause a large release of the neurotransmitter dopamine. Repeated surges of dopamine in the reward center from drug taking can lead to addiction. Every day in the United States, an average of 2,000 teenagers use prescription drugs without a doctor's guidance for the first time. Opioid addiction often begins legally when patients are prescribed opioids as painkillers. However, at least 61% of college-age individuals reportedly use prescription pain medications that were not prescribed to them. Adolescent and young adult wisdom tooth extraction is one of the most common first exposures to opioids, and dentist prescriptions account for 31% of adolescents' first exposure to opioids. Adolescence is a critical time for preventing drug addiction. Early use of drugs increases a person's chance of developing an addiction. Many factors can add to a person's risk for drug abuse. Risk factors increase a person's chances for drug abuse, while protective factors can reduce the risk. Common risk factors include teens who are in periods of transition, suffer from mental health disorders, and lack positive adult influences. While it's practically impossible to prevent anyone and everyone from using drugs, there are things we can all do to avoid drug or alcohol abuse. Avoid temptations and peer pressure. If you have friends or family members who use drugs, keep your distance and make new friends who practice healthier habits. Develop goals and dreams for yourself. Remember, alcohol and drug use can turn to addiction rapidly. No one plans on becoming a drug addict or alcoholic. Find the support you need. People struggling with emotional distress are at a greater risk for developing an addiction to drugs or alcohol if they have not developed healthy coping skills. If you have events or experiences in your past that affect your feelings, find a reliable and healthy source of support. If you have other mental health problems such as depression or anxiety, counseling and social communities such as religious or spiritual organizations can help you work through negative emotions. Alcohol and drugs in combination with mental health disorders only make the mental health problem worse. Don't try to self-medicate your feelings or physical discomfort. Practice healthier living habits. Exercise, eating well, and meditation are excellent ways to avoid using drugs or alcohol. Quite often, the results you feel from living a healthier lifestyle can help you resist the temptation to use drugs or alcohol to escape.